How's it going, everybody? My name is Jesse. Welcome back to Male Nurse Mentor. You guys saw the title. Today we're talking about the TEAS test. In this video, I'm going to give you guys a crash course on everything you need to know about the TEAS test, and use the timestamps down below. We're going to make it through this video. If there's something specific, check out those timestamps. They're very helpful. You could jump around. But I get it, friends. The TEAS test, it's a big deal. It's a very important test, right? You want to take it seriously. You want to give yourself the best chance to get into a nursing program. So first off, what is the TEAS test? The TEAS test stands for the Test of Essential Academic Skills. And that test itself is developed by ATI. Yes, the good ATI. When you're taking the TEAS test, studying for the TEAS test, you're going to get very familiar with ATI. And if you're curious what ATI stands for, it's Assessment Technology Institute. And as far as what the TEAS test is itself, it's a standardized multiple choice exam used for students applying to nursing programs in the United States. And from what I understand, apparently other health programs also ask for a TEAS test. Although I haven't actually heard of this personally, I don't know which programs ask for it, but just something to keep in mind. And because of that, you do want to be careful in terms of which one you select. One's going to be for nursing, one's going to be for allied health professionals. And if you're just curious what allied health professionals are, it's just other members of the healthcare team of the healthcare network. And as far as what's on the test itself, like the material, there is reading, math, grammar, and science. And as far as the price itself for the test, it ranges anywhere from $106 to $120-ish. $106, I was surprised, at least here in the state of California. My CC, the community college that I went to, is actually only charging $106. So if you're in California, Yuba College, go Yuba. I was surprised. And I will say it's important to mention here, there are other similar exams like entrance exams for nursing programs apart from the TEAS. There's the KAPLAN that I've also heard, and the HESI that I'm also somewhat aware of. All of these are kind of entrance exams. TEAS, from my understanding, is one of the more rigorous ones. There's a consensus feeling that that is the most challenging one. And from what I understand, at least California state universities and a lot of community colleges, the TEAS tends to be the most popular one requested. But just know that there's also the KAPLAN and the HESI, but I won't be talking about the KAPLAN or the HESI for the sake of today's video. So why is the TEAS test important? So as mentioned, this test is used for entrance into nursing programs. It is part of the admission requirements and the application process, in this case for nursing programs. And because of that, this does make it a very important test. And just to be blunt with you guys, it really should be taken seriously, as the score of this TEAS test can really have a large impact on the success of you getting into a program or not. So that is why this test is important. So now let's talk about how to take it. How do you take the TEAS test? So to take the test itself, it's the ATI website. Once on that website, on the front page, for example, it gives you the option to register for an exam. A really neat feature now, I think, since post-pandemic, is you can actually not only take the test in person, but it now gives you the option to take it online and remotely, which is also a really cool option for people. For example, when I took my TEAS test, they only offered in person. I went in person to take it. It wasn't that bad, but being who I am, if I could choose an option, it would probably be remote. If I could avoid leaving my house, I would. But for you guys, I'd recommend whichever one feels most right. I know for some people, you like to have a certain test environment feel, which may not actually be at your house or at your desk, but in an actual setting. So if that's you, in person, but if not, there's that remote option. For the remote option, just know the only difference is there will likely have to be a camera somewhere placed in the room that is looking at you, because the test, even though it's done remotely, it will still be proctored and taken highly seriously. One interesting thing I'll just mention here, because I am talking about the remote option, they do still offer you a 10-minute break if you take it remotely. Like, I think you could go use the bathroom and then come back. So interesting. And as far as how to prepare for the TEAS test, so to prepare, you may find your own method, but what I recommend again is just going directly to the ATI website. Get it straight from the source and buy your materials from them. And when I talk about materials, I'm talking about study materials. They do offer packages, and they're the ones directly running this whole entire test. So if you're getting your materials straight from the source, they're the ones who create the questions, they give you the study material. That to me just makes the most sense, and that's actually what I did as well. And when you get to the website, you're gonna find there's a couple options. It could be a little intimidating, you know, which one do I choose? What I recommend is just choosing the package for $99, and I'll tell you why. I don't see any value in the extra study prep materials. What you really need is just a study guide. In there, you're gonna find all the rationales. You're gonna go through the whole entire book, start to finish, read the rationales for the questions. They have a couple practice questions in there. That's one large component of your study material. But in that $99 package, what you'll see in there are the 2 practice tests. It's like test A, test B. Those are very, very, very valuable because it's practically like taking a TEAS test in real time, just practiced, right? Just in a practice format. And you can do it twice. Test A, do that, test B. The best way that I recommend preparing, just to take it step by step, go start to finish in the study guide, take a test A, take it, see what you scored. If it's a score you're comfortable with, take test B and see if you can kind of get the same score. If you go to take that test A and the score isn't what you want, go back and study the rationales, study the ones you missed, and then go back and take test B and just kind of work through that. Depending on what your score is now in test B, go back again and study the rationales until you're ready to take the test for real. So how soon should you start to study during your prerequisites for this TEAS test? So friends, from my experience, I want you guys to give yourself plenty of time to take this TEAS test, and that includes studying for it, signing up for it, getting your materials for it, taking it, and then having the time to take it again. And I'll explain later in the video when I give you my one big tip as to the reason why. So what I recommend is begin to think about your TEAS test when you're about halfway through your prereqs, when you're about halfway through, or when you're about a little bit over a year to applying to your nursing programs, right? Like you have a little bit over a year before you apply to your nursing programs. That is the time when you should start thinking about the TEAS test. It gives you a full year, and I'll explain why again later on in the video. And as far as how soon can you retest if you want to take the TEAS test again. So I went to the ATI website. They have like a policy of 14 days in between, you know, a retest. What I recommend though, because 14 days is just not enough, you're gonna know when you take the test that 14 days is not enough, but if you're very ambitious, I recommend highly against it. What I recommend is waiting at least 1 month before you retest. The test itself isn't cheap. It's $120 every time, $120 a pop to take that test again. So what you wanna do is make sure you, again, take it very seriously. 2 weeks is not enough. I say 4 weeks at the minimum before you go and retake it. Depending on your score, you're probably gonna have to go back and study that study guide again. Look at the rationales for the ones that you missed or the ones that you're having difficulty in. And this just takes time, especially when you're still doing your prereqs, right? With your prereqs, you're focusing on your grade. With your ATI, you're focusing on a score. That's also very important to get into a nursing program. So do take your time, don't rush, take it seriously. So if I can only give you one tip, friends, it would be this one. Work through this idea, but allow yourself the mindset, the time to take it more than once. Go into it taking it the first time like you're gonna go and take it again. Just have this mindset shift. Allow yourself that grace. Take a lot of that pressure off just from the very beginning. This is why earlier in the video I mentioned to not begin to think about the TEAS test until you have about a little over a year to applying to your nursing programs, or you're about halfway through your prereqs. The reason being, you don't want to take the test too early, because then it will also impede on the time that you're taking to really focus on these core prerequisite classes. Those classes like anatomy, physiology, chemistry, microbiology, classes that you're really supposed to try to get an A in, right? Now, if you throw in the TEAS prep and study material in too early, you're taking and you're pulling some of that mental bandwidth away from actually that study time that you would have for those classes. So if you do it too early, you're just putting on a lot of stuff on your plate and you're increasing your own workload. If you begin studying too late, you don't give yourself enough time, right, to then take it again. That's why that sweet spot is around the halfway point through your prereqs. You're gonna see a lot of people when they go to apply for their nursing programs are just rushing through the study guide of their TEAS test, rushing to take their test, and they don't get the score that they want. Versus, hey, right, buy the study material, kind of come up with a game plan. Maybe you're studying on the weekends. You're not rushing to the destination. You got these weekends, you got about a year to study. Take 3 months to study. Sign up for the TEAS test, take it. Hey, maybe you still got 5-6 months left. You don't like your score, study another 1 or 2 months, take it again. Maybe you don't like your score, maybe even take it a third time. That is my rationale behind this, and my one big tip to you guys is go into this test with the mindset that you're gonna take it again, but because you're gonna do that, you need the time to do it. And just to be transparent with you guys, I took my TEAS test a total of 3 times. And when I didn't get into my nursing program the first time, it kind of slapped me in the face a little bit. And it made me realize my TEAS score needed to be higher. I got 84 the first time, 85 the second time, which didn't feel good, and then 87.9 the third time. So put in the time, put in the effort, and you'll get the result that you want. And as far as like one in-test tip that I have for you guys, it is this one. And it's actually quite simple. The test gives you a 10-minute break. The first time I took the TEAS test, the second time I took it, I didn't take my 10-minute break. The third time that I took it, I did take my 10-minute break. I took things even more slower, more relaxed. I had been there 2 times prior. I knew what to expect on the test, and I actually took my break. And when you take this break, the test stops. It stops for 10 minutes. So take that 10-minute chunk, go and use the restroom, stand up, get some oxygen, close your eyes, take your time, and slow down, right? Give yourself that mindful break. Take those 10 minutes, come back to the screen. Who knows? Maybe you feel better, maybe you don't, but at least you took the time to really give yourself that mindful break in between. And that is it, friends. I hope you enjoyed this video. I did put in some time to research it, kind of put this together in a crash course format. So because of that, if you did enjoy, my only ask is hit the like button and share to someone who is probably thinking about taking the TEAS test, or they're a little bit far away, but you want them to understand what it is. Send that video to them. Give them that great opportunity to prepare. If you have any remaining questions, leave a comment down below, or go and look me up on Instagram at Male Nurse Mentor. Send me a DM like a lot of you guys always do. I'm always very, very, very reachable. So send me any questions that you guys got and I'll get back to you. But anyways, friends, I'll see you guys on the next video. As always, I'm always around. You know where to find me.